pelvic abscess with ring of fire. This was seen in a 33-year-old para-2 who was admitted in surgical ward and discharged after 11 days on admission on account of acute abdomen. At presentation in the surgical ward, her temperature was 38 degrees and the pulse rate was 111. She was referred to the gynecology clinic on account of ultrasound diagnosis of an aneurysmal mass. At presentation to the gynae clinic, she still appeared ill-looking and was still on her antibiotics. She was febrile and not pale. There was tenderness on abdominal examination in the right lower quadrant, and there was also probe tenderness on TBS. The sliding sign was negative. Now this is the image from the video. You can see this well circumscribed lesion seated in the uterovesical pouch and pushing the uterus backward. Here you can see bowel closely related to the lesion. So let's see the video with drawing so that one can appreciate the relationship between the lesion and the bladder. This is the bladder, this is the uterus. So this lesion, which is consistent with abscess, is in the uterovesical pouch, not this thick wall, and not what looks like peritoneal thickening here, not the bowel here, and look at the momentum here encasing this lesion. Note that anteriorly the sliding sign is negative. As you can see, this the probe is in the anterior fornix, and you can see that there is no sliding movement of the bladder over this lesion. So the anteriorly the sliding sign is negative. So you see that. So soon you will see I will draw the probe as I'm just doing now, and insert the probe into the posterior fornix to demonstrate posterior sliding sign. Here you can see that the movement is limited. Look at the fundus of the uterus. Look at bowel here. We'll attach the fundus and this lesion. So this feature is in keeping with the pelvic abscess. And of course, you can see that because of its thick pus, it will not move on probe pressure. You see that? Look at these strands or laces of pus. Look at the thick content, not the thick wall here, and the bowel. So this is the lesion, highly suggestive of abscess, and not the peripheral color flow. So ring of fire appearance is not only seen in corpus luteum or in ectopic pregnancy. It's also seen in abscesses and other conditions, as we shall see in the next slide. So this is uterine fibroid in the piparium. You can see this ring of fire. This is a case of spontaneous ovarian hyperstimulation syndrome. You can see this particular cyst, which is hemorrhagic. You can see this what looks like ring of fire. This was a case of duval ectopic pregnancy. You can see the ring of fire appearance. And this was a case of ovarian cancer, mucinosis adenocarcinoma. So look at the ring of fire appearance. So here is a case of interstitial ectopic. Look at the ring of fire around the interstitial ectopic, and another ring of fire around the corpus luteum. This is the grayscale. So this was the transvaginal ultrasound of this case, of the ring of fire appearance, which is actually first described in ectopic pregnancy. And of course, look at the ring of fire around corpus luteum and around the index case. The case highly suggestive of a pelvic abscess. So these are some of the differential diagnoses of ring of fire appearance. Thank you very much for listening.